kick this off.
Awesome.
All right, let's go ahead and kick this off. Joining us today is Eric Rothgeb, clinical massage therapist, licensed acupuncturist, and diplomate in canonical Chinese medicine, and he will explain what the hell that means shortly. A disclaimer, can't do anything without satisfying the lawyers. This is for educational purposes only and should not be interpreted as medical advice. Uh, I have to begin on a personal note. I can personally attest to Eric's skill as a clinician. You were with me through all my injuries and surgeries, and what I can safely say that without you, there would be no Feltovich fit. So thank you.
Thank you.
Eternal gratitude. All right. A lot of people either don't know or have some serious misconceptions about what Eastern or Oriental medicine even is. Could you explain it to our listeners?
Right. So, I mean, and if we're going to look at Eastern, we're also looking at other parts of Asia like India. So, the oldest continually practiced system of medicine is Ayurveda, which I have minimal training in. But so Chinese medicine, which is like Han Dynasty medicine about 2,000 years ago, that is the system of medicine that they teach in the schools in China. And then basically it's the same curriculum interpreted into English for us. So we're literally using the same textbooks they use in their curriculum right now. And so our when we finish and get licensed, our depending on the state, right? So in Illinois here, I'm a licensed acupuncturist, and that allows me to do the body work. Also, we part of our board exam, we finish our degree, and we have to take an exam to practice the herbs, to practice the acupuncture, and to get our license. So the herbal medicine is a huge part, actually a much bigger part of the schooling here, and then everything else is kind of postgraduate work. Um, so
Okay.
yeah,
That's interesting. So 2,000-year-old Chinese medicine is the new kid on the block as far as Eastern medicine goes, and Ayurvedic medicine, they were the original gangsters. That's fascinating. I had no idea.
they had that the Silk Road, so where they very similar. So like somebody who would learn Ayurvedic acupuncture, it's the exact same thing. They just, we use what they call the 5-phase system where we're using elements like fire, metal, earth, water, wind, and they've got the 3 doshas, the kapha, pitta, pitta, kapha. So it's a way to view the body and diagnose, in particular for internal diseases, right? Where we're treating internal medicine. My practice, even though I've trained in a lot of that, is like with when you came, it's a lot of musculoskeletal and orthopedic stuff. That's kind of where I specialize in.
That's fascinating. A complete random side note tangent. I know that there were some Roman coins found along that Silk Road, so I'm wondering if there was any interchange between any early interchange between Eastern or Western medicine at that point.
Absolutely. Like, so, and I can't quote exactly because these were things that I did learn that did not retain. And then, with the burning of the Library of Alexandria, I mean, there's so much lost information that was there, but there's proof that there was communication. One interesting thing as another side note is I'm really into this studying fascia. That's one of the things I've been doing the last few years. And one of the there's a university in Italy called the University of Padua, and one of the teachers I've been studying with, her father, Antonio, or that's the son, Stecco, in the University of Padua. They've got really old anatomical, where they're doing. It's got the beautiful wood, atrium where they're doing the stuff there. So her father wrote a book in 1987 about fascia and acupuncture, probably one of the first people to ever do that. But he was using texts that were there that were like 500 and 600 years old to kind of put this all together. So there's a lot of stuff that's out there that had been translated into other languages via trade. So I don't know for sure um, So if there was, but there had to have been communication in that.
So let's dial it back a little for our listeners who, like me, really know uh, very little. When you stick a needle in somebody, what are you actually trying to do?
So it's just a treatment. So sticking a needle in you, or pressing you with my elbow, or using your hands, or using a tool. The needle, we use stainless steel disposable needles. It's basically all about getting blood to flow to that area, right? So it's a sterile, single use thing, just like if your body would get a piece of glass or a splinter, your body is going to attack that thing as non-self, right? So you've got this whole metabolic reaction going to the site of the needle, including, increased blood flow. That's really the crux of all of it. How do we get, because we're looking to create movement. Either something is kind of stuck, like a muscle knot or something, or something is too weak and we want to increase the flow from one section to another. So in a nutshell, that's really the point of the needling, is just to create blood flow in that local area and or peripherally, right? Like distally or proximally above or below that. And then the sequence in which one would do the needling, depending on what area you want to hit, right? So we're like where it's directed to.
So, do you see Chinese medicine as an alternative system, or do you see it as complementary to traditional Western medicine?
I would actually say complementary. An alternative, it's hard to parse words, but it's really, again, because like if we're looking at Western medicine, if we're looking like, Greek, Galen, that aspect, so if, the typical medicine that we grew up with, as Western, right? So I would say now, probably both complementary and alternative, right? So some people may want to take just herbs for, an illness versus taking a med. Um, Not that, that I'm not against pharmaceuticals. It's just that if people would rather not do that, because obviously way better on your liver and your kidneys. Um, but there are certain things that it's not going to be as good as, like, for emergency medicine, or even crazy things like fungal diseases. Oh,
Okay. The unholy trinity, broken, torn, or infected.
right, right.
You're probably still better going off to the ER.
Yes.
So let's talk about the origin story and your clinical evolution. So, how did a nice boy like you end up in Eastern medicine? Any seminal event, teacher that
Yeah,
catalyzed the decision?
actually, yeah, there was, I it really is, kind of a spiritual thing, honestly. I grew up, uh to a couple things. Being really, like, sick as a kid, standard American diet,
Haha.
horrible digestive issues, um, skin issues, headaches, and I remember going to the physician, and, "Oh, just take another Tylenol, just take another Tylenol," and even as a kid, you're like, "Really? Taking," and I remember at one point in high school, I was taking, like, 12 Tylenol a day for just things like headaches and stuff. I'm like, "There's gotta be more to this," right? And then I met someone who, was a shiatsu therapist, who was one of my first teachers and forays into this, who, he had gone to a chiropractor in Illinois and Chicago here. Where it's pretty big. We've got several Chinese medicine schools, several chiropractic schools. We've got naturopathy here. So it's kind of cool. We've got a lot of alternative medicine here. So in my, like, probably 19 or 20 years old, it wasn't Chinese medicine at the time, but I remember had a really horrible strep throat, and I saw an MD who practiced anthroposophical medicine, which is a shoot off of Rudolf Steiner's work, another own system. And I remember he gave me these oregano oil tablets, and in the past I would just be taking a round of antibiotics, and it like went away in a day. And I was, wow, that just was amazing. And then I started, like exploring, initially this was all through body work, and just so, and in my Christian upbringing with the church, there was healthcare wasn't brought up into that. But when, you meet these people kind of in the new age community, there's like a lot of, Native American stuff here, and they have their own medicine. And I was like, oh, well, this is interesting. So there's a way to kind of have a spiritual kind of understanding of the world in the medicine. So like that's that sense of holism. That's how I learned about it, was like mind, body, spirit, in that sense, from meeting alternative practitioners here. And then get through receiving like therapeutic body work for musculoskeletal stuff. And then I learned about herbs and stuff. And it just became something that I was absolutely fascinated by. And of course, circuitously, I didn't do the typical 4-year degree. I quit college and worked for a while. And then I eventually went back, and the massage certificate here is, about a year program. And then I there's so many offshoots you can do. Uh, kind of, if you when one becomes a massage therapist, you can learn about cranial sacral therapy. You can learn different manipulative techniques, bordering on something like a chiropractic or a naprapathic manipulation. So I just started seeing that there were all these other things I could learn, and then eventually that's what got me into going to school for Chinese medicine, because they had a system. Originally, it's based out of Taoism, and you can see that, but then you could see how like you could take that into your own life and however you view spirit and God, and make that, use that as a framework, right? To practice the medicine and treat patients, right? Seeing a patient holistically, by being treated that way. So that was kind of how I got into it. And still to this day, I'll take class, spiritually based, uh, kind of medical practices that are kind of go a little bit woo woo, and then very, very clinical, neurologically based, like movement systems.
That's fascinating. We could take this conversation so many directions, but the spiritual component is really interesting because in the Western world with our Christian bringing, it colors our world in ways that we might not even recognize or fully appreciate in our everyday lives. So God, capital G, God created the universe with certain laws of how it operates, and we discover those laws and use that to manipulate this system of inputs and outputs to achieve our results. But lots of other religions, and I'm not a theologist, so I will keep this very brief, they focus more on positive and negative energies and how that can color or affect us one way or the other. So do you see that fundamentally different way of how different religions and spiritual practices viewing the world affects the different medical practices throughout the world, given your experience in Eastern and Western traditions?
Well, I would say, like what we probably both grew up with here was, it was, you know, you had that spiritual part, as a kid, right? You go to church, you do this, but then you didn't see how that fit into um, like your physical, your mental life and emotional life. I could see how spirituality fit in, but like the physical part, right? So how did, I that making that connection wasn't so right. So, but and if you study, I love, after, the typical, I grew up Lutheran. So, once you're 14, you get confirmed and that's it. But then I started like, well, is there more? And then there's like all of these non-canonical Christian texts. And one of them I thought was fascinating was like the Essene Gospels. And these were things that they found like in the Dead Sea Scrolls, like other writings of Jesus were like talked about taking care of your health and eating a healthy diet. And so I was like, oh, this is what I wanted. And then you could see the parallels with other systems, right? Um, so I do think a lot of the people that practice, I would say Chinese medicine, that at least that I know of, have that holistic view, and of course may interpret it in their own way, right? Everyone's once you get into uh, personal philosophies and personal theologies, it's just like kind of like it just goes everywhere else. But Chinese medicine has that framework where um, we would say something as a disease of the spirit, which maybe in the past we would call possession, right? But somebody having a mental emotional breakdown or someone who's schizophrenic or something like a spiritual crisis, right? So you see, these are all things that you can tangibly feel in someone's pulse and doing like a diagnostic reading, right?
Yeah, yes, that's fascinating how we really compartmentalize everything in the Western world. So we go to church and we talk to God, and then we go to the hospital for our medical care, and then we go to the psychologist for our mental care, and everything is very compartmentalized, which is bullshit, right? It's all interconnected.
And then only at the end of your life, then the chaplain comes back in when you're going to die, right? So it's like, so during your life, it's like it's not integrated so well,
Exactly. We wait to the end to do it right.
right?
So let's talk about your the Pranajaya clinic. How do you evolve as a clinic? What gap in care or philosophy were you trying to address?
I started out initially, um, you know, wa desiring and wanting. I loved the more esoteric part of it, but again, as patients come in and present themselves, uh, someone's coming in with a torn meniscus or a rotator cuff injury, and the woo-woo stuff isn't going to help so much with that, right? I needed some tangible proof. So I really, I was so lucky. The massage therapy program I went through, very clinically based, and it was just a lot of hard study into, anatomy and physiology and just nuts and bolts. And at the same time, I just found that absolutely fascinating, like how the body worked, just the depth you could go to in studying this. So I just started getting presented with people, with things that I was like, oh my God, like initially it was more of a kind of a feel good relaxation kind of a thing, and then if somebody's presenting with a rotator cuff tear, right, I mean, you've got to know how to treat that, and what your limitations are, know when to refer out, right? But I wanted to learn more. I wanted, like, well, what can I do? What can I, what are the things that we can do? Like, why does someone get a rotator cuff tear? What's their movement like? And then you just start to have to kind of deduce and go back and like, okay, I need to learn this. I need to learn this. And that's really how the clinic started developing, and then just kind of snowballed, through word of mouth, through just treating people, making some mistakes. Fortunately, nothing terrible. Maybe giving some people some bruises here and there, but nothing life threatening. But but as where I'm at now, I still treat, it's mostly people with ongoing chronic conditions. I see a lot of people who've got hardware and metal plates and stuff, and they it's the maintenance. They can do their own self-care and their own PT and exercise, but if somebody's you know uh for instance, one person out there I treat, here's a vertebrae here, here's one here, and they're fused. And, that's in that person's neck. And that person has to be in a computer all day working, designing websites, putting that person back together and giving them the tools to lengthen and strengthen and try to gain some sense of symmetry. So I see a lot of people who are like that. And I've gotten pretty good at that. So that's kind of how it evolved.
So you've got a lot of tools in your toolbox. So how do you determine what modality or combination of modalities is right? Needling, the manual work, the herbs for a given client. What's your diagnostic battery?
Um, well, first, like if someone's coming in with, you're going to do your orthopedic exam, right? You'll do your muscle testing. You'll do your typical orthopedic exam that any PT or chiro would do, right? That what we would do. Um, Somebody like that, initially, I'm not thinking of herbs yet. Until you get into the treatment, but then you've got to get your hands on the body first. So it's like you might have when they call and say, "Hey, I'm coming in with medial knee pain." Oh, you immediately, you can start to think like, "Okay, I'm going this direction." But until that person presents, you just kind of have to explore, touch their body, make sure that what they're describing is what you're feeling. Like, because, people come in all the time and say, "Oh my God, I've got shoulder pain," and it's their trap in their neck, right? And you're thinking rotator cuff, but they're to their trap, right? So until you start to touch them and say, "What do you feel? What do you feel when you do this? What do you feel when I do this to you?" So then it's like, okay. So one thing that I do a lot that I is and then you remember this is I love if some and this is such a common thing. People come in, uh, they're they work 9 to 5. Um, they're at a computer all day, or a mom having to drive her kids around all day. It's that kind of like muscle taut, that fascial stiffness. So like the sliding cupping, right? Cupping is amazing. I think it's completely underutilized to, just, kind of oil up the area and just to release those tissues, just by sliding it and getting that erythema and getting that top layer, the subcutaneous layer, that superficial fascial layer that, the right under the skin. And then you've got those two layers before you hit the top layer of the muscle, the epimysium. You've got your superficial and deep fascial layer. And that, if you can manipulate those, I start by opening that up. And then it's like, okay, do I even need to needle, right? Sometimes I don't even have to needle anybody, because it's not called for in that treatment. But if somebody comes in and they've got a rotator cuff tear and they haven't been sleeping, they're having problems with their spouse, and then it's like, okay, I'm going to use something to calm their body down, calm their central nervous system down. Then I start thinking of herbs, and that's when we feel their pulse. And that, um, in Chinese medicine, we do a lot of pulse and tongue reading, and the pulse is really more for like an internal medicine, right? Pulses are really designed to like prescribe herbs. It can help a little bit with an acupuncture treatment, but not so much for an orthopedic treatment, right? Um, so I'll just start to deduce how do I get this thing to move? How do I get this thing to be more pliable? And then it's like, do we do more manual work, or do we combine it with something else?
So fascia's an interesting topic. That might be the next frontier. It's even been said, do we have 700 muscles or whatever it is, or do we have one fascia with 700 compartments?
Exactly. Yeah, it's like it's its own. I mean, when I went to school in 1998, and this was a new term for me, it was just this very generic definition. And this, conference I went to last year, where there's a whole big section on the nomenclature of what fascia is, and can we change it? Can we manipulate it? Um, and there's still so much that we're figuring out, and we don't know. One of as an offshoot, one of the cool things I learned, uh, it was a conference where it's called Fascia Summer School. So all these teachers come in from the University of Padua, and they're doing histological research. They're doing stuff with ultrasound. So these studies are fantastic, and they had just discovered in fascial tissue like receptors for cannabinoids. It's like why does the human body have cannabinoid receptors if we hadn't been using them, right? Like this plant material, and as well as things like they haven't published a study on androgens, but certainly finding estrogen receptors in the fascia, which is like, oh, this is why, it's a majority of our, sudden onset frozen shoulder patients are menopausal women as estrogen drops. And it's like, oh my God, that makes so much more sense. So we're just like learning these other connections that we have with the fascia that we just didn't know were there, and certainly requires a lot more study.
So we're going to become full-fledged fascists today with all this fascia discussion. I like that spit take. I managed to time that right as you were taking a drink. So one of my mad scientist theories, a couple years ago, I started taking speed lessons, sprinting lessons. And my thinking was that I was going to help my clients who wanted to get faster. And in the course of this, I started just moving and feeling better than I'd ever felt. I was like, what the hell? I've got movement in joints that I haven't had for years. And the only thing that I could think of was that sprinting uniquely engages the elastic properties of all the muscles and fascia, or nearly all the muscles, as many as you're going to engage in any physical activity. All I could think of that it was engaged, that sprinting uniquely engaged all the elastic properties of all the fascia and tissues and did it synergistically. So is there any merit to my bullshit theory?
Um, Absolutely, absolutely. Not enough that I could clinically explain it at the time, but absolutely yes.
Okay. Absolutely. Yeah, so it was great fun watching the fastest man in Dallas try to teach the slowest man how to run, but by golly, I'm pretty damn fast for an arthritic 46-year-old short white guy. So mission accomplished. And
Good, and
more importantly, I feel a lot better.
you're sprinting now.
Exactly. Yes. Yeah. I need to get back into it. But actually, that's going to be my action item to get back into it after this. Let's dig into herbs a little more, because this was just a huge blind spot for me. As much as I like to think that I'm on top of the game, it's just a minefield with so many areas to get tripped up, like strain, extraction method, potency. So explain some of those details and how you can get tripped up if you don't know what you're doing.
Yeah, so it got, especially right, you go to Whole Foods or you look online at these, or any of the supplement things, and it's like you just see like, oh wow, ashwagandha, yeah, and then it just becomes this big, oh my God, that everything sounds great. It's a panacea. I want to do that. I was like that too. I don't know if you remember when you lived here, we had a health food store here. I miss it so much. It was called Sherwin's, and you could get almost every herb there ground up. And then, you could experiment. Um, in our medicine, in Chinese medicine, what we learn is we're typically learning East Asian herbs. Um, Cinnamon, licorice. These are things, ginger. These are things, and a lot of them are food that we use every day. Typically, you're going to take the raw herb. You take somebody's pulse. You know, they tell you their chief complaint. You ask a few follow-up questions, and then you would get this bag of either 8 to 15 herbs, sometimes more, sometimes less. So they're pretty much all done in a formula. Like, so you could look at like, oh, we know cinnamon does this, or and this herb does this, but that it's the synergism of a formula that makes it unique, and how you're dosing it. Like, oh, 6 grams of cinnamon here, 9 grams of ginger here, but then you change those doses and it changed the property of how it affects the body. Now, what we tend to see in like the stores is like it's just these single herbs. I almost never use a single herb, right, for a patient. Um, unless it's some of those things that have been highly, clinically studied, things like milk thistle. That's not in our pharmacopoeia, but it's amazing for muscle recovery, ATP, for energy. It's amazing. We can combine that with some of the other herbs. I use in my practice, instead of giving somebody a bag of raw herbs, we use concentrates. These are powders that have been pre-cooked, usually at a 5-to-1 concentrate, and then we can make the formulas. It's just a lot easier. It takes up a lot less space, and they stay fresh for a long period of time. Um, I think it's not to say that the single herbs don't work well. It's just that you can hit a bigger bullet. You can hit a much broader thing when you've got these larger formulas, and then you just treat somebody until that symptom changes or their pulse changes and goes away, and then either you continue on them on another follow-up formula, or or you just stop because you're better. I do use in my practice the ones that are like again, like things like milk thistle. Berberine has been having a big kind of comeback. Berberine is a substance extracted from several different herbs that have berberine content. I'm sure you've seen a lot of this stuff online. Um, Basically kind of acting as a way, kind of acting like metformin in your body's reducing your glucose intake for the body. But the downside to that a lot of people don't know is it can give you diarrhea, just like a lot of the diabetic meds can, right? So somebody is saying, "Oh, I heard, berberine can help me reduce my glucose numbers," but then you give them the bottle and then they got the runs after one pill. So we would classify that as a cold herb, these bitter flavored herbs that aren't for everyone. So, and that really depends on that person's kind of constitution that day, and how well they digest and break things down. Um, that's something that I'm continuing to study and have just found fascinating. The One of the things I did right after I graduated school was I found a guy who, Arnaud Versluis, who started the Institute of Classics in East Asian Medicine. And he's got a 2-year post-grad course, really going into stuff that we just cannot go into school. It's just, just way more in depth, and learning how to read the pulse, and then just going back to these original formulas. And we still use about 75 to 80% of these formulas written in the Shanghunlin. Again, it's about 1800 years old, this book. And then the other systems of herbs that developed after that are all based on that system. So I just think that that's fascinating. Like, it's kind of like going back to you read the Bible if you want to know this, right? You got to go back to the source, back to the source text, and just kind of figure out, and then finding somebody who can kind of interpret that for you, right? Because some of these things are really difficult to read, and especially when you're dealing with translating things from one language into English. There's often very not an equivalent, right, word. You're just trying to make the equivalent. Um, I just find that fascinating, and incredibly helpful. I mean, I take herbs pretty much every day, just to, when I'm bad. Oh, sorry, go ahead.
I was gonna say, speaking of lost in translation, one of the books that you got me on, Spark in the Machine, it talked about some of those issues translating, uh, Chinese to English in the context of, it's mostly a book about acupuncture, but also Eastern medicine more broadly, and it talks about some. So I highly recommended it to me, and I found it absolutely fascinating. Let's dig a little deeper into a word that keeps coming up, pulse. You keep talking about reading the pulse. What exactly do you mean by that?
So different than, you go to your doctor and they're going to feel your pulse and they're going to count your beats per minute, right? And You want to have a nice low resting pulse. And if your pulse is too fast, like, oh, did you run here? Did you have some caffeine? So we're feeling your artery in both hands in three positions. We're using our first three fingers right on the wrist in three positions. So you're feeling the top. So you're feeling the arterial wall. So you're going through the skin and like, how does the artery feel? And the quality, we've assigned qualities. So you're feeling the fascia on the top of the artery wall. And it's basically this round tube pumping blood. And we break it up into three little sections with the three fingers. And the top part closest to the wrist is going to be kind of that upper part of the body from the chest up. So your heart, your lungs, your nose, your pharynx. The middle position is going to be like your liver, your spleen, your digestion, depending on the hand. And then the lower part, we're going to look at like pelvic floor things, or like something prostate, bladder, or female pelvic stuff, right? And then so we assign these qualities. We'll say, okay, this is wiry, or this is tight, or this is what we call a spinning pulse. So you learn through clinical practice, like what you're feeling under your fingers, and that's how you then, oh, okay, this is typical of this herb formula family, like for instance a cinnamon formula family. So we're going to give this patient a cinnamon based formula because that's kind of where their pulse is at. And somebody else might come in, uh, your wife or your girlfriend come in, you guys are both sick. You come in, but like you can have completely different pulses, and I'll give you two different formulas just because of the way that your body is reacting to a pathogen, and then the way their body's going to react to the pathogen. So that's how we prescribe an herbal formula for a patient. And then you think, like, for a follow-up, you're like, okay, this is what I'm feeling. And the trajectory is like likely, okay, it'll probably go here or here. And that gives you a nice framework to use the medicine.
So let's dig into the pulse and some of the things that I learned about Spark of the Machine, some of the things that you've tried to educate me on, the embryology and the meridians, and how you can learn so much, how you do the muscle testing, and you can learn so much about the organ function by looking at these things that are seemingly unrelated.
Well, I want to just, as a caveat, the muscle testing, I know a lot of people might be,
And I'm sure I totally botched the science.
no, but like,
The
no, but you're right. Cause there's like applied kinesiology where, like, someone puts supplements in their hands, like, is your hand strong? And that's not Chinese medicine. That's AK, that's its own thing. But some Chinese medicine practitioners do use that. Um, I'm sorry, repeat the question again. Just where were we going with this?
Yeah, just talking about how you can learn so much about the pulse, and
Oh,
my que and a lot of my questions stemmed from the stuff that you've been trying to teach me, or stuff I read about in Spark and the Machine, about the embryology and the meridians, and how these peripheral things are, uh, seemingly unrelated, but nonetheless connected to the
yep.
different
So
organs.
like, for instance, so we would have one of the things that we see a lot, we call this somebody comes in, I would say a majority of people come in because, like, I've got gas, I've got bloating, I've got diarrhea, I've got constipation, I've got these are things that we call, so we were to break it down in a simple way, we're going to either attack, like, so you're sick, we're going to give you something to your immune system. We want to boost your immune system to fight whatever that virus or bacteria or thing will be. And then we would go into a place where we would harmonize, where it's kind of a little bit of both, right? You've been drinking, you've been eating bad food, and this is going on. So we look at these harmonizing formulas, and then we would move toward, when you start to get a little bit better, that's when we would tonify someone. That's when you want to give somebody, you know, something to boost them up. That's where, like, the ginsengs come in, and that, because otherwise you can't really utilize something that would be And I guess now we in Western medicine we would call those adaptogens, right? That wouldn't work as well if your GI system's screwed up. You know, it's kind of like wasting that plant. But for instance, you know, people come in, everyone is stressed, they're watching too much social media, and it's this, you know, I'm feeling tight in my ribs, I'm annoyed, I'm irritable. And then you could break down into like, okay, you know, are you are you frustrated or are you angry? And then you start to feel the parts of their body. So for instance, one of the things that I see a lot are this annoyed, frustrated, and that could manifest as more of the anxious or the more irritable, right? You know, that depending on how it manifests for someone. But then you can see like, oh, so that, you know, the real irritability, like, okay, that we would say that energy can kind of go up and you can have, you know, ringing in the ears. You could have migraines, the stuff that kind of goes up. But then you can kind of see, oh, well, how is that? What part of your body is that affecting? And often the side of the body, you know, so like, you know, a kind of a headache here or grinding the teeth here or the traps here. So that's like we call the Xiaoyang.
And just for the listeners at home who maybe aren't watching the video, you're placing your hands on your face, your head, so things that
Right. You know, like, you know, or, you know, you get really ticked off at someone in road rage. Blah. You know, you're just, it's that, you know, it's something coming up that you ideally wouldn't want to come up. So you're like itchy, burning red eyes, burning ears, ringing in the ears, a headache on the sides of your head or a headache on the top of your head, clenching your teeth, right? Or feeling really stiff, like, you know, like in, you know, like you're trying to rotate your body to, you just try to find a place to get comfortable where you just can't get comfortable. That's something that we would look into, like, you know, the side channels of the body. So we're looking a lot like, okay, how can we get this person either through body work or movement, like to get your ribs to shift, right? That kind of lateral movement and getting your ribs to move. So then you could get to a place where, okay, now we can do a breathing exercise where let's expand your lung into that area. So that would go into like your formula for herbs, your acupuncture treatment, and or your local muscle treatment, right? You know, super, I mean, like somebody up in the upper trapezius or like in your hips, that side of the body. That's something where like that's something I just see like every day. So that's the way that that informs each other. And then you'll get your random weird thing where you have to just try to figure out where that fits in to the rest of the pattern.
so you talked about a lot of things that are affecting my guys, the namely 40-plus-year-old male executives, entrepreneurs, senior professionals. So let's dial into men's mental health, and particularly aging men, where perhaps the coping mechanisms stop working. That's the joke. Coping mechanisms work until they don't. So
Right.
unresolved, and you can take this anywhere you want. Unresolved trauma, depression. One of the books it's not a I have some issues with it, but I don't want to talk about it about male depression. So we suffer twice. We suffer from being depressed, and then we get depressed about being depressed because we're men and we're not supposed to be depressed or have feelings. So what are you seeing, particularly with men in that cohort? Trauma, uh, unresolved trauma, depression, mental illness, and yeah,
Well,
tell
I think the biggest things I see is in that group is high blood sugar, raising A1C, right? People who are starting to go into some sort of metabolic disease, because that just kind of seems to be the progression. And in an inflammatory diet, right? Or an inflammatory lifestyle, like, you know, not moving, right? Not exercising, not moving your body. Because the whole thing about like, you know, in Chinese medicine, this whole moving qi, you know, it's really about homeostasis, right? You know, so what I see in my men 40 and up is, especially as they get older, um, and they're much like guys in their 60s, it's much easier to talk about anxiety, but a lot of insomnia, restless sleep, you know, sleeping and not feeling rested, um, some urinary issues, which would be, you know, prostate, that, I think that's there. Um, but the biggest thing I think I see is just like, and this is what's great about kind of practice like mine is I often will see their spouses. So I get a completely different story from these men's partners. Oh, and you're like, oh, okay. So that's what's great is to like, oh, he's not sleep, they can they can go further in depth with their depression or the anxiety. But I think men, the alcohol is a big thing that is completely overused and abused. And again, that just ties into the metabolic stuff. Uh, and just makes the issue worse, right? Dries you out, makes you more irritable. Um, so a lot of it is just kind of like an education with these patients, telling them how these things are all connected, and then the steps that they need to do to at least start to mitigate that, and I'm sure, and getting people to move. I think like a practice like yours is harder than mine because usually people come to see me when they're sick and they're not, but like very often the first thing I'm telling people to do is like, you got to get up and move. You just got to start something, and because that's an active thing that, some people just don't want to do. But the first thing you do is like, you got to get up and move, basic dietary things, no sugar. You'd be amazed at how often you've just got to break down the basics for these people and tell them why and how that the, you know, especially if they're looking at ED, any sort of erectile things, it's like it's blood flow, it's your sugar. I mean, it's like these are and exercise, right? And just telling them, I think, once you start to tell men uh how much, then they're much more willing to like cut down
Yeah.
when they see the correlation there. Um,
Yeah, those are the things that motivate people. Their erections, their golf game, uh,
exactly.
looking good looking good for the dating apps.
Right.
Yes. So you heard it here, folks. If you wanna fix those problems. So let's talk about, you've been extremely generous with your time. So let's go ahead and move on to the lightning round. Uh, what's the most underrated herb or formula in your pharmacy?
Oh, underrated. There's an herb called Futsa, which is quite controversial. It's aconite, which in its raw form is poisonous. It has to be prepared a certain way and washed and washed and washed to decrease the toxicity of it. That is like, what we've learned is the king of herbs, and that's ultimately something that I use a lot of it. And you've got to learn how to use it, in these certain doses. But like for women too, but particularly for men, when they get to the point where you start to get depleted, I use so much of that herb for men because ultimately, once you get past the point where like, okay, I'm eating well, my blood sugar's pretty good, I'm exercising, and you can take care of like, right, like you can't give somebody to help them to tonify them if they're still doing all this stuff to their body because it's just too much of an herb to give them. So they've got to, once they're at that place, then you could put them on like a Futsa aconite based formula, and then they can just really start to see like, oh, it's the energy improvement, right? It's the brain fog lifting, the improvement of their energy, the urinary issues, right, from prostate or pelvic floor things. And a lot of men have pelvic floor issues, not because of anything in their prostate, but it's mostly from sitting. A lot of these sedentary jobs where you're just sitting improperly all day, and with like the low back. So you're using this herb then to like bring warmth to that area, so everything down there functions better. Your bladder, your prostate, your penis, all of it. And that's something that maybe a lot of people in the general public aren't aware of. Um, but interesting. You're lucky there in Dallas. I don't not so much about Dallas, but in Austin, there's two really good schools. Texas is interesting that you've got a lot of really good um, Asian medicine practitioners there who are excellent with herbs.
Good, good
Yeah.
stuff. So What classical text do you revisit regularly?
Um, there's two, but it's actually one book. Uh, that book I was telling about. So that the Shanghan Lun. So this is one of those things that it's called On Cold Damage in English, and that is that 1800-year-old text where these original this guy Zhang Ji went through this horrible epidemic where most of his family had died, and he had um prior knowledge. So some of these formulas are even older than that, but he was using this, and he finally, he wrote this big tome, and then over the years, commentators have added so much to it. So I'll go back to that when my teachers taught me, go to the original source. Now that we kind of know how to read it and how to understand it, and to kind of understand the original meaning of it. So then when you're adding other things to it, so like I'm going to throw out milk thistle again, just for lack of a better word. So if you're modifying something, you know why you're doing it, right? So I'll visit that one a lot. Is the Shanghan Lun.
So, what's the biggest myth or misunderstanding about acupuncture or herbalism that you would like to disappear or at least stop hearing about?
Well, that it doesn't work, and it's like energy medicine, right? Because I mean, herbal medicine is natural pharmaceuticals, right? These are pharmaceuticals. Most of them are derived from plants and substances, so they're really powerful. They work, and you should really be careful just buying stuff online that might not be good for you. You could be completely ruining the effect that you're trying to that you want by kind of like buying all of these supplements and kind of not knowing what they do. And the acupuncture part, I think a lot of people might understand like the dry needling aspect better. So like there's that correlation between that and acupuncture, is that it doesn't work, right? You know, I would say I've heard people say that, oh, I tried acupuncture and it didn't work, but like they went one time, right? It's like, I took one pill of my prescription and it didn't work. It's just that it's amazingly effective for pain. Sometimes we can make the pain go away in an instant. Now, we're for recovery, tears and repairs, that's obviously going to take a long time, especially if you've had a long-standing low back issue or something that's been weak. The time that it took for it to get there, it's going to take your body a little bit of time to recover. But it's just an amazing
Yeah.
uh, method for pain, and for the people that I see, for relaxing the body, relaxing your central nervous system, just to chill your body out.
Yeah, don't get me started on rehabilitation. People tell me
Right.
surgery doesn't work. Well, how long did you rehab it? Oh, 6 weeks.
Right. And you've lived through, right. I mean, you've had, I don't know how many you've,
Yeah, you're gonna have to name it the Andy Feltovich Memorial Clinic. You've got me through so many injuries and surgeries, but yeah, it's how long do you have to rehab a joint? As long as you want to use it, right? It
right.
was
And your level of like what you want to do. You want to play tennis, or do you just want to put your groceries away? Right. Right. You got to do it until it's better. Um,
yeah. So like for
with exercise, right?
yeah, so like for me doing high level strength training, it was um on the order of 18 months to 2 years before I achieved pre injury level performance. But it is possible, right? We've done it multiple times, and hopefully we don't have to repeat that experiment any further. Last item before we let you go, your call to action. So somebody who's dealing with pain, stress, fatigue, what's their first step that they should take?
I mean, first of all, Google is great. Finding out who in your, most people are going to see, um, generally your Western medical physician would refer you out, or they could give you a medication. I would say, if you're finding a practitioner, look at their training, look at their credentials, make sure that they didn't go to a weekend workshop, right? We're all trained very differently. And even in my field, like, whether you see somebody like me who does body work and massage therapy and acupuncture, but a physical therapist or even a chiropractor, somebody who's got a background in physical medicine. So I would see who's in your area, because if they're not close by, you're not going to do it. Right. So finding out who's close, and Google's going to help, but, don't put it off, get on it right away. Don't let these things linger, because these issues don't go away on their own, and they don't tend to resolve on their own.
Not fine wine. They do not get better with age.
Right.
So last but not least, listeners want to learn more about your work or explore Pranajaya's offerings. What resource should they look
Yeah,
at?
you can go to www.pranajaya.com. It's PRANAJAYA.com. And numbers on there, got an email on there, and take it from there.
All right, and I highly encourage you to do that, especially if you're in the Chicago area. Like I said, Eric has personally worked with me for several years, and he comes with my highest recommendations. So, Eric, we're very blessed to have you today. Thank you, sir.
Thank you, sir. All right.